When an individual receives a diagnosis of ADHD, the clinical conversation usually zeroes in on a very specific set of behavioral struggles. We talk about managing executive function, overcoming chronic procrastination, and finding tools to stay focused in a world built for neurotypical brains. But according to an invaluable clinical report published by Attitude magazine, addressing ADHD in absolute isolation leaves out a massive piece of the psychiatric puzzle. Leading mental health educators, including psychiatric nurse practitioner Desiree Matthews, reveal that up to a staggering 70% of adults living with ADHD map onto at least one other co-occurring mental health condition. This high prevalence rate is forcing medical professionals to drop the traditional term comorbidity and embrace a much more comprehensive framework known as multimorbidity, recognizing that conditions like major depression, generalized anxiety, and complex PTSD can live alongside ADHD as entirely equal, independent drivers of impairment. To understand why these conditions are so inextricably linked, the research points directly into our biology. ADHD and mood disorders don't just happen to show up together by coincidence. They actively share deep-seated genetic root causes and neurobiological pathways. Scientists are looking closely at the dysregulation of serotonergic pathways in the brain. Because the neurotransmitter serotonin plays an essential role in regulating everything from mood and sleep to impulse control and basic cognition, disruptions along this pathway frequently serve as a dual launchpad for both ADHD traits and clinical depression or anxiety. Because serotonin acts as a primary buffer against chronic stress, this shared genetic vulnerability leaves neurodivergent individuals, especially women, at a profoundly elevated risk for experiencing compounding emotional distress. The real danger in this overlap lies in the subtle art of diagnostic camouflage. Because psychiatric symptoms are highly transdiagnostic, meaning they easily cross over the lines of different disorders, a core feature of ADHD, like a lack of concentration or intense irritability, can easily be mistaken for an anxiety disorder or a depressive episode. To prevent individuals from falling into the exhausting trap of misdiagnosis, clinicians use a vital metric. Is your current treatment plan actually improving your holistic quality of life? If an individual is taking ADHD medication and finding that their daytime focus is sharp, yet they are still struggling with chronic insomnia, severe emotional distress, or persistent low self-worth, it is a definitive red flag that a deeper mood disorder remains completely unaddressed underneath the surface. Ultimately, Attitude's analysis delivers a powerful message of hope. ADHD and complex mood disorders can be safely, effectively, and cohesively treated together. However, achieving true emotional stability requires a highly customized, non-linear approach to triage. For example, when a patient presents with both bipolar disorder and ADHD, clinical guidelines dictate that the bipolar disorder must be stabilized and treated first to prevent ADHD stimulants from accidentally triggering a manic episode or worsening insomnia. By utilizing specialized screening tools, tracking treatment responses over time, and closely monitoring medication interactions, we can move past the confusion of overlapping symptoms. We can build an intentional path to wellness that respects the full, complex reality of the neurodivergent mind, ensuring that every layer of a person's mental health receives the exact validation and targeted care it deserves.